Thanks so much for joining us for this update on the city's efforts to enhance public safety and mental health support. With me this morning are Lincoln City Council Chairperson Sandra Washington, Lincoln Police Department Chief Michon Morrow, Lincoln Police Department Southeast Team Captain Ben Kopsa, Centerpoint President and CEO Topher Hansen, Centerpoint Senior Director of Community Response Amber Dirks, and Centerpoint Co-Responder Therapist Brittany Scarborough. My administration is committed to making Lincoln the safest and healthiest capital city in the country, and in pursuit of that goal, our Lincoln Police Department has worked hand in hand with our community partners to establish the Co-Responder Program, one of my administration's priority pillars. And the Co-Responder Program enables mental health professionals from Centerpoint to respond jointly with our police officers to certain types of calls for service. And through our Co-Responder Program, trained mental health professionals are on hand to deliver immediate and specialized care when our community members experience a mental health crisis. And this collaborative approach provides a more focused and effective response to the mental health needs of our community while ensuring public safety. We made a commitment to hire these co-responders by early 2025, and that's what we're here to talk about today. This morning, I am so pleased to announce that the City of Lincoln has officially begun implementation of our co-responder program. Centerpoint has already hired 2 co-responders who are actively responding with LPD to calls for service, and a 3rd co-responder will start in early April. Here to share more details about our co-responder program is Lincoln Police Department Chief Michon Morrow. Chief.
Thank you, Mayor. Good morning. I am so excited to be here with you today. I know that this has been a conversation within the administration, the Lincoln Police Department, and our community for some time now, but here we are. So this shared vision that we've had for the co-responder unit, CRU, or CREW, as we fondly call them at LPD, has officially become a reality. The CREW team is being housed at LPD headquarters. That's here in our main building, and they're adjacent to our Southwest team and our lineup room. This really is allowing our co-responders to engage with officers, get to know them, not just on these calls for service, but in a comfortable facility. Getting to know one another at that level builds rapport and trust that we believe is imperative for this kind of partnership to be successful. Since May 1st of 2024, LPD has responded to more than 12,000 mental health related calls for service. That's roughly 12% of the more than 102,000 calls for service in that time frame, which was a 10-month period. Nearly 4,000 were specifically mental health and suicide attempt calls, some of which required our officers to place the individual into emergency protective custody. These numbers, as we know, are significant and demonstrate the need for the services of our co-responder unit. As we prioritize mental health services, the work of our behavioral health unit, Southeast Team Captain Ben Kopsa will also continue to oversee our mental health coordinator and our co-responder program to ensure a seamless transition from concept to full implementation. I want to reiterate our department's commitment to understanding and addressing all of the challenges that those who call Lincoln home face every day. As at LPD, we continually strive to serve the whole person. The growth of these partnerships allow us to broaden our focus while we're not just addressing criminal behavior, but also ensuring that we're caring for the well-being of our entire community. Mayor?
Thank you so much, Chief, for your leadership and for helping us get to this day. I'd now like to invite up Lincoln Police Department Southeast Team Captain Ben Kopsa. Congrats on that promotion, by the way. He will talk about how LPD is working with co-responders to facilitate an effective partnership. Captain Kopsa?
Let you go behind me.
Thank you, Mayor. Good morning. Today's announcement is the culmination of years of work and progress as we shift from planning to implementation and begin taking on the immense responsibility of connecting community members with mental health resources during calls for service, as opposed to following up with them after an incident. Officers can request mental health experts either when they are assigned a call or after interacting with a community member and determining that co-responders are needed at the scene. Additionally, clinicians can decide to respond based on radio traffic and case information, waiting for officers to secure the scene before entering to ensure safety. Our vision is for these professionals to be active in the field as much as they are needed on a call, while also doing community engagement when possible to get feedback that informs their work and builds relationships with both officers and the community. LPD officers who have already worked with Crew on scene have provided positive feedback about the program in its infancy. One officer shared they were very impressed with the patience and concern that Crew showed to a community member, and that they consider Crew a valuable resource to use in the future. Another officer described Crew as an outstanding program, while others have said that they're extremely helpful. We're excited to keep hearing feedback from our officers, co-responders, and the community so we can keep improving and keep making our response even better together. Mayor.
Thank you so much, Captain Kopsa, for all you've done to shape this program, and we love hearing that great feedback. Part of what makes Lincoln's co-responder program unique is the strong partnership between LPD and Centerpoint, and here to share more about this unique and latest collaboration is Centerpoint Senior Director of Community Response, Amber Dirks. Amber?
Thank you. Okay, so first I want to say thank you to the City of Lincoln, Centerpoint, and Lincoln Police Department for allowing me the opportunity to be part of this program. It's definitely been a vision that I'm excited to be a part of and bring to reality. As part of the hiring process, Captain Kopsa and I conducted interviews together to ensure that we selected highly qualified candidates that aligned with the mission and the culture of this program, not only for Lincoln Police Department, but for Centerpoint as an agency. Our goal was to build a team that could effectively support individuals in crisis while also fostering a strong collaboration between behavioral health professionals and law enforcement. The clinicians hired are Centerpoint employees who work alongside officers within the police department as part of the behavioral health unit. The co-responder therapists are onboarded at Centerpoint, where they are trained in suicide risk assessment and management, de-escalation, and other policies and procedures specific to their role. They also gain experience working with our crisis response teams and street outreach teams, who also make this program a possibility. To help them integrate into law enforcement environment, each co-responder spends 120 hours doing law enforcement training. At least 80 of those hours are completed prior to responding in the field. Their training covers areas such as radio procedures, de-escalation techniques, emergency protective custody statutes, use of force and tactics, officer ride-alongs, and other relevant topics. Once field response begins, I accompany each new co-responder for at least the first 2 weeks to help integrate them into the role. This allows for hands-on guidance, real-time support, and smoother transition as they begin working alongside officers in the field. To date, our team has responded to 23 calls for service. Of those, 81% of people were successfully resolved in the community, meaning 15 individuals received help without needing further emergency intervention. Follow-up is also a key part of this program and our approach, with 69% of people receiving additional follow-up contact with our team and 19 participating in a full 30-day follow-up to hopefully get them established in ongoing care and community resources to decrease contacts with law enforcement in the future. These numbers reflect not just response, but ongoing care and connection within our community. These outcomes show the real impact of early community-based response, life stabilized, crisis de-escalated, and support delivered where it's most needed. But to truly serve our community, we have to keep learning. The data we collect helps us understand community needs, identify gaps, and make this program even stronger. We are committed to adapting to better serve our community, improve outcomes for those in need.
Well, thank you so much, Amber. The holistic approach that the chief talked about and that you've just described is part of why this is such a success so far, and we're so grateful for everyone's commitment to continuous improvement. We're now going to hear directly from one of our co-responders, Brittany Scarborough. She is one of the 2 co-responder therapists who joined Centerpoint at the beginning of this month. And at this time, I'd just love to hear her come and share a few words about her experience as part of the crew. Brittany?
Thank you, Mayor. As a co-responder therapist with the co-responder team, I've had the opportunity to support individuals in some of their most vulnerable moments. When we respond to calls involving mental health crisis, our goal is to always de-escalate the situation, provide compassionate support, and help connect the individual to the services they need or reestablish connections they may have lost. One of the most rewarding parts of this work is seeing how recognized people's worth, treating them with dignity, and meeting them with understanding can profoundly change the outcome. We are not just there for the moment. We're helping to break down stigma around mental health and encourage people to seek ongoing care. Because of this approach, we've helped individuals remain safely in their homes, avoid hospitalization or incarceration, and re-engage them with vital services. By being on scene with LPD, we're also helping officers return to service faster so that they can continue responding to the needs of our community. It's a collaborative team effort, and I'm really proud to be a part of it.
We're proud that you're a part of it too, Brittany. Thank you. So for decades, Centerpoint has helped Lincoln be a community that supports the well-being of every resident. And I'd now like to invite up Centerpoint President and CEO Topher Hansen to share more about how the organization he leads complements the work of our public safety professionals. And he's got a few years on his resume to talk from, so come on, Topher.
Thanks. When she says a few decades, she means I started doing crisis work 50 years ago and even responded with police into the field on outreaches and so on. So my experience goes way back in this. But the thing that I note in all of this that is so important here is the community that this establishes, the relationships that people are willing to establish with one another. And then, as you've heard from people talking, the synergy that comes out of the strength of the Lincoln Police Department being willing to take in a partner and Centerpoint staff willing to join in that training and understand it and coming together so the whole easily exceeds the sum of the parts. And that's what you want in strong community. So I can't go further without saying thank you to Mayor Gaylor Baird and Chief Morrow for your vision on this and your willingness to have this relationship and the commitment to strengthening mental health and substance care in our community. I also want to thank Captain Kopsa, congrats on the promotion, as well as our incredible team at Centerpoint. These folks are two of several, and it goes on for ongoing care. So there is more than just the crisis response. There's also a team that can do ongoing care for mid-management and counseling and things like that. So the other team members that are important in this is our Chief Operating Officer, Tammy Lewis-Arndt, who is also the incoming CEO as of July 1, which means, I guess, that I'm retiring on June 30. So, but Tammy has been an important part in operationalizing what we've been doing. And also Dr. Ryan Carruthers, our Chief Clinical Officer, who oversees all of the clinical programming. But especially Amber Dirks. Here is the champion to our end of this, in that Amber took the words of my vision around wanting to really increase crisis response to be a meaningful operation in the Lincoln community, and she has put legs on it by establishing solid relationships, showing her competence in the mental health arena, and really doing an outstanding job in building the program from the Centerpoint end. So to you all, thank you, and this would not be possible without the crew that we're talking about and understanding here. So last year, Centerpoint served 5,200 people, the largest number in our 52-year history. We continue to see the demand for crisis intervention grow, which is why we're expanding access to immediate, compassionate care, which is so critical to long-term positive outcomes. Over the last 5 years, our partnership with the City of Lincoln has allowed us to expand crisis response services to meet the growing need. Programs like our street outreach, alternative response, our mobile crisis, and our sober living that we call Link Point, where people might go if they're stopped for a DUI or public intoxication. Those programs have made it possible to reach people where they are, connecting with them the care that they need instead of relying on emergency services or the justice system to respond. So right tool, right job, right response for the right situation. The co-responder program builds on that success, ensuring that individuals experiencing a mental health crisis have the right response at the right time. 3 weeks in, we're already seeing the impact. By embedding behavioral health professionals within law enforcement response, we are helping to de-escalate crisis, connect individuals with care, and reduce unnecessary hospitalizations and justice system involvement. With our extensive experience providing crisis response services, we are uniquely positioned to not only provide immediate intervention, but also ensure individuals have a direct path to ongoing care and support in the community. This trauma-informed, person-centered approach strengthens our ability to help people beyond the crisis moment, creating better long-term outcomes for individuals and families. This is what meaningful collaboration looks like. This is synergy, bringing together behavioral health professionals and law enforcement to create real solutions for our community. CenterPoint is really proud to be part of this effort, and we remain committed to ensuring that people in crisis get the care they need when they need it. Mayor?
Thank you so much, Topher. I want to just acknowledge what an important role the Lincoln City Council has played in getting us to this moment. Not only are our council members key partners in supporting all of our city programs and services that support health and safety and wellness, they also provided some of the initial seed money from the city that laid the groundwork for the co-responder program. And a big person involved with that was Lincoln City Council Chairperson Sandra Washington. So I'd like to invite her up now to share her perspective on the co-responder program and how it will foster an even safer and healthier Lincoln. Councilman?
Thank you, Mayor. As chair of the Lincoln City Council, my highest priority is to help ensure everyone in our community is safe and healthy. As we celebrate the launch of the co-responder program today, I also want to acknowledge the significant investment of time, effort, and resources in reaching this moment. For example, back in 2021, I and the rest of City Council supplemented the budget by $125,000 to increase resources available to LPD to explore options for enhancing their response to calls for service involving a mental health challenge. Then in the most recent city budget, we approved the continuance of funding for mental health services, part of which goes to support this co-responder program. I continue to be committed to collaborating with our community partners to deliver innovative solutions to complex challenges, and the co-responder program is an innovative solution to the complex challenge of mental health. In short, what sets the city's co-responder program apart is that LPD and CenterPoint can draw on each other's strengths, resources, and expertise to bring the greatest benefit to residents most in need of mental health support. On behalf of the Lincoln City Council, congratulations to LPD and to CenterPoint for achieving this landmark and for your diligence in making this day possible. Thank you. Mayor.
Thank you so much, Chairperson Washington. So the city's implementation of the co-responder program is a testament to how we work with community partners to get our community members the care they need when they need it. With co-responders on call, we are on track to make Lincoln the safest and healthiest capital city in the country. And with that, we'd love to open things up for questions from the media. Yes?
All right, so this funding you have here, yeah, that's a good idea. There we go. So this funding that's laid out, this goes till first 3 years, so 2028 then?
Let Chief explain more about our federal grants from the Department of Justice, but we're very fortunate to have those in place to help support co-response.
Thank you. We do have 2 federal grants that are helping to fund the co-responder program, the largest of which was $550,000. The majority of that grant is for the salary of our co-responders, now out there working alongside our officers, responding to mental health calls. And then we have another grant that is also going to continue to allow the possibility of additional training and the resources that we need for them to continue to be successful. These grants were 3-year grants, and so we certainly recognize and thank the city because there was a city match for that $550,000. And moving forward, we'll have additional conversations and exploring further grant opportunities to not only continue, but with success as we continue to get positive feedback and we see our community members having a different experience by getting the resources that they need that is allowing them to stay stable in their homes. Again, trying to keep them from hospitalization or potential incarceration. As we continue to see that, that is motivating for us then to also consider the possibility of future growth within the co-responder program.
All right. And then you talk about the number of calls, 12,000 mental health related calls for service, 4,000 specifically heightened with emergency protective custody. Y'all have mentioned the difference that in the past few weeks this program's made. What has it been like without this program when you're making those emergency protective custody moves in the field?
So our officers are trained, and they've been very well trained over the years, but honestly, we're not the mental health experts that have had years and years worth of training and experience. So for us, oftentimes these calls for service are longer and more engaging and may result in us needing to reach out to further experts in the field that may require a trip to the hospital. In certain circumstances, it may require us to take somebody into emergency protective custody. So the goal by bringing in those that are trained and have this expertise is to reduce those numbers of transports, again, to the hospitals, to the crisis center, and potentially to jail.
Have you seen any reduction in EPCs since you started this in the last month?
I think we're probably too quick to make that. We're just very much in the infancy, and while we see success, we're getting very positive feedback. I don't know that that's a number that we could share now, that we can see a reduction, but what we would share is part of the grant. I mentioned salaries and training and other resources are two other components, and those are, one, an educational piece with our partnership with the Malone Center through community conversations and growing the understanding within our community and certain areas in our community that this exists. And additionally, because we want to ensure success, that means we have to be willing to look at the numbers and understand them and tweak and make changes to continue success. So that is a partnership with UNL, and we are actively sharing all of our data, and will continue to do so with the responses from the co-responders to get us a big picture. And we do hope at some point to share that. We're just pretty much in the infancy where
I mean, there's a lack of mental health services in this community. So will this program, are the services, do they exist to connect people to reduce those hospitalizations and EPCs?
I think this is a perfect question for me to pass off to Centerpoint.
Yeah, so like I mentioned before, crisis response teams and our street outreach team are also part of this program implementation. So really, we have our co-responders that are doing that initial contact with officers in the field, and then we are diverting that over to our crisis response team to do that follow-up contact and provide them ongoing follow-up. We say an average of 30 days, but realistically, we will meet with them until they can get established into services. They actually coordinated to go pick somebody up that we met with in the community that didn't have transportation to bring them in for an intake and assessment to get them connected to services. So that's really part of our goal, is that we are providing those additional services through even our crisis response teams in that interim to assure that people are getting that ongoing care, collaboration, connection, and they can get service connected.
And tell them about ongoing too, that it goes beyond crisis.
Yep, so then again, crisis is that interim, and then we can get them established, and we have primary care, we have psychiatric services, we do same day access to intakes, assessments to get them into outpatient therapy, potentially residential treatment if that's something that they want to get into. So we have a variety of services that we can get them service connected to
And
beyond.
Those other services, those non-crisis services, are there enough of them to handle the need?
I mean, I think mental health in general is an increased need, so we as an agency continue to evolve and to continue to expand our teams to provide that ongoing care, because there is an increasing need for that. So I know as Centerpoint, as an agency, we continue to expand our outpatient teams to better serve the community and to make sure there is access to care, because we know there are gaps in the community or there is a lack of resources.
Does this at all work together or build off of the alternate response program that's been going on since 2023? Does it, since it works together as well with Centerpoint?
Feel free. Go ahead.
So they are going to be different programs. Alternate response is one that was established prior to this program, where our street outreach team, they are actually getting the dispatch calls right to them based on questioning to make sure there's no safety concerns, no medical concerns. and that there's no crime being committed, and they actually respond independently without law enforcement to keep that rapport and to provide individuals in the community who are experiencing homelessness the support they need. And then this is going to be a different branch where we are actually responding with with law enforcement, and we are therapists versus peer support specialists.
I don't know if you can give any more specific examples. Maybe I'm looking at Brittany, maybe, or were you, about as in this month that this has happened. I think you gave some numbers about the number of calls that were people who were diverted from possibly incarceration or EPC. Can you give any specific examples of cases? I know you don't want to talk about individual people, but how were some of those cases resolved?
You want to speak to it?
Sure.
Maybe there's one that sticks out.
So we've, there was a case that we went to where the person was very upset, had some significant losses, and was really struggling. And we were able to, the officers and I were able to go into the home and get the person service connected and provide some counseling against lethal means, establish a safety plan and use some coping skills in the moment to de-escalate that situation. Where going into it, the officer was more apt to EPC the person, and that was kind of what they had talked about doing because it was a pretty heightened situation. And we were able to de-escalate that situation, provide safety measures to keep them safe in their home. The individual was calmed down by the end of the call. They were able to increase the number of therapy sessions with their counselor, with their therapist, did get them service connected, and also provided peer support for them. And we did not EPC that person. Mm-hmm.
Great. Thank you.
Mm-hmm.
Well, I want to extend my gratitude to you, absolutely, for your partnership and leadership and for what you're doing for our community members. And thank you for incredibly innovative partnerships and programs that you're taking on and leading, and for the resources to make them so. We're really grateful to have this opportunity to share this story with you. Thank you for tuning in to learn more about how the City of Lincoln and our community partners are focused on responding to the mental health needs of our community members and ensuring that everyone is safe and healthy in Lincoln. Thank you.